into anti-reflux surgery now.
Yes.
If you were to break that down to like just again a layman, what would that be?
Now, see, anti-reflux surgery is done to treat this acid reflux. Now, what does acid reflux means? We have this food pipe in our chest area, then in the tummy comes our stomach, which stores the food. Then eventually that food passes into the intestines.
Yeah.
Now, junction between our food pipe and stomach, it has a valve which is tight and prevents the food and acid to come back up. Okay. But due to our modern lifestyle, our dietary habits, we do some silly things like eating a lot of fried food, drinking soda, alcohol, smoking, chocolates, spicy foods. This will make that valve loose. When that valve is loose, it lets the food and acid to come back up. So when the food and acid comes back up, you feel those heartburns. If it comes to your throat, you may feel throat irritation. Sometimes you get some cough. If it comes to your mouth, you get bitter or sourness in your mouth. It may have some atypical symptoms like having asthma-like symptoms for a very long time. So it affects your quality of life. And there is a slight increase in cancer risk because of continuous exposure of acid to your food pipe.
Wow.
Okay. Not too much, but a bit.
Yeah.
So it needs treatment. So treatment entails diet first because it happens because of your diet. So you need to cut down on smoking, alcohol, sodas, fried food, spicy food, coffees, chocolates.
Yeah.
Even after doing diet changes, if it doesn't help, there are those medicines which reduces acidity, which increases stomach motility so that food passes into the intestines faster. There are a significant number of people who do not benefit from diet or even the medicines. In those patients, they need surgery. We need to make that valve tight. So usually we wrap their own stomach around the food pipe and make it tight. So
you use their own stomach?
Yeah, patient's own stomach. Stomach is a stretchable organ. So
okay.
The stretching part, we wrap it around the food pipe. It's called a fundoplication. But that makes the valve tight and it prevents the food and acid to come back up. Again, with laparoscopy, so no big cut. So it's a pretty much safe surgery.
See, everything is just a bit mind-blowing for me. So I mean, just excuse the shock value as well. And then also just on that, because I know I have other questions and I'm trying to make sure I stick within the hour because I know you have you have other important things to attend to. Okay. So how soon does a patient actually need that procedure done? If let's say maybe they've detected there are CDT for probably, is it a month, a year? After how long should they actually now consider surgery as a priority?
Now, see, it always depends upon your symptoms. If your symptoms are getting better with just diet changes or maybe medicines, you don't need surgery at all.
Yeah.
Then you don't need to go for it. Yeah. If you're not getting better with surgeries, if you're not getting better with diet and medicines, then obviously you need a surgery. But when to do it, it also depends upon the other changes. Like when we do an endoscopy, if we see a lot of changes or damage in the food pipe, then surgery needs to be done as soon as possible. If you don't have those changes in the food pipe, that it has not damaged it yet, then it's not an emergency. You can plan it out, like during your vacation, or if you have some leaves piling up, you can use them.
Yeah.
So you can wait a bit. It's not like that you need to do today or tomorrow. It's not that.
So you can just actually give it a little bit of time before you jump into it.
If you have those danger signs in food pipe that it has already started damaging the food pipe, then maybe you need to go as soon as possible.
Prioritize on that.
Yeah.
Okay. What's the post-surgery care for this as well?
Yeah, so post-surgery, when we make their food pipe tight, initially it is more tight because it was loose and suddenly it's tight.
Yeah.
So there is a significant difference for yourself. So you may not be able to take solid foods immediately after surgery. So we need to start with liquids first diet. As you tolerate liquids well, we add some soft diet like mashed potatoes, rice, something like that. As you tolerate it better, you go on to other hard stuff. For meat and all, we first start with fish because it's the softest form of meat. Then you go for chicken and steaks, and those things will be the last thing. So we gradually progress as you tolerate it.
Interesting. Okay. So now let's jump into hernia repair, because
Yeah.
that's also something that you've specialized in. So how would you, again, just describe it in layman's terms? Because I think the craziest part is like just your ordinary person just walking the street. They just do not know the definitions
Yeah.
of things that they might be going through or
Yeah.
they can even relate to.
Yeah. So see, hernia is a basically defect in a muscle of your body. Okay. Most commonly the abdominal muscles. You see, we have these abs and obliques, which keeps our intestines and the fat around intestines in place. It just doesn't come out by its way.
Yeah.
So there can be some defects in the muscles through which the contents inside, they may try to come out. So the most common sites for this defect are the groins for males, and these navel area, or the area where you have undergone a surgery before. So when you have a defect there, the intestines or maybe the fat or the internal contents would just pop it out. So you may see a bulge. But when you lie down, it may fall back because of gravity. So that's a hernia. Now, there is no medication which can repair the muscle defects. You need to repair it via surgery. So you need to close the muscle defects by suturing it.
Yeah.
And for adult patients, you need to cover that defect area with a thing called mesh. It's a net-like material which will strengthen your muscles so that chances of hernia coming back are minimal.
Okay. And then does that, say we call it a mesh?
Yeah.
Is it something that dissolves or it still remains like permanently in your system to just control it?
There are dissolvable meshes, but it has specific indications. Like if you go for a surgery in emergency, something like that. But if it dissolves, the strength is lost. So we need non-absorbable meshes. So it needs to stay there forever. But there are these inert materials which doesn't create much reaction with your body. Although we need some reaction in your body for mesh to get adjusted, but there are these specific materials which doesn't create much complications.
Okay. And then like now, are there maybe like lifestyle or occupational factors that actually cause
hernia?
Hernia.
Yeah, there are lifestyle factors like smoking and alcohol. They can make your muscles weak. So more so smoking than alcohol. So it can be seen more in the smokers. Obesity. So if you are obese, that also, see, when we have this fat, it accumulates everywhere. So it can go between your muscles. So when your muscles start getting some fat, your muscles become weak. And then it can have some defects.
Yeah.
So smoking, obesity, doing activities which can put a lot of pressure on your tummy. So heavy weightlifters can get a hernia if exercises are not done properly. Or some things like natural diseases, like a lot of cough, constipation. If you have to press a lot to pass urine, or sometimes pregnancy itself can bring hernia.
Interesting. And then also, like, even just on occupational, what about people who are doing things like construction? We see them like some of the healthiest people. So does this,
because they have to lift heavy things
every day?
Yeah, when you're hammering, you put a lot of pressure on your tummy, so these things can bring it.
Oh wow. So you see, like, at times it could be like the healthiest person, even like probably a bodybuilder or somebody with a very healthy lifestyle, but these can actually,
they can still have it.
Wow. Okay. So can someone still go back to, let's say they've already been accustomed to like the kind of work that they're doing, which involves heavy lifting.
Yes.
After the procedure, can they go back to that?
Yeah, but not immediately. We advise not to go for the similar kind of work for at least 1 month, because that is the time needed for your wounds to heal and mesh to get adjusted around that area. If you go for that heavy work immediately, it can create this tension in the tissues. The hernia site may open up again. So after surgery, for at least 1 month, no heavy exercises, no gymming. So we ask them to take a rest. We give them later that you should be staying away from heavy work for at least for a month. But over the time, gradually, you can go back to your work. That's the basic purpose of mesh, that you should be able to do those things.
Okay. So gradually after a while, you can, then just not go all the way out and start doing
start
extremes.
slowly and then gradually increase.
Okay, perfect.